around us continues to change, Florida Blue remains focused on our commitment to help keep Florida at its healthiest. With Medicare Advantage HMO plans that received Medicare's highest rating, 5 out of 5 stars. And you can switch today. No need to wait for the annual enrollment period. So call or visit online now. It starts with the benefit of $0 monthly plan premiums. But staying healthy is now more important than ever. So Florida Blue Medicare's 5 stars go even further. With enhanced benefits like $0 outpatient mental health services, $0 primary care telehealth available 24/7, 90-day prescription supply by mail, and free support from neighborhood nurses. All part of our 5-star commitment to you. So call 866-308-6110 and get the 5-star rated Medicare HMO plan that's right for you. Our experts are standing by. Call and switch today.
Welcome. We are so excited to have this month's Blue Seat sponsored by Florida Blue. But more importantly, who's in the seat is the really great treat for you this month. And this will air for our April segment, 4 months into 2021, and cannot think of a better person to have in the Blue Seat this year. Of course, you can still see that the Blue Seat is on that virtual platform. So I'm officially wearing blue. And then our guest today, Jeanne Freeman, has blue in her logo and she's wearing a blue top. So we've got you covered with the blue today, okay? But today's subject matter, and I can't think of a better person to help us talk about it, is leading and serving during a global pandemic. And when we think about this subject matter, wow, who better to think of as the CEO and the leader of Neighborhood Medical Center, and that is Jeanne Freeman. So Jeanne, welcome.
Thank you for having me. This is exciting.
Oh, good. Well, I'm thrilled, and so I'm going to be stumbling over words and everything because it's been a long time since I've had the opportunity to actually talk to you. I mean, I've seen your name and all that kind of great stuff. I was like, oh my God, I've got to connect. And I think we may have played email tag once or twice, but to actually see you on the screen is definitely a pleasure and honor. I have so much respect for the work that you do. I mean, wow, Neighborhood Medical Center has been around since 1974 and providing amazing health for our community in so many different ways. And of course, if you have not heard, then I don't know what rock you're sleeping under, but they have been very instrumental in getting the vaccine out to our community. And I'm really, really proud and excited about that. But Jeanne, you do so much. So can you give us the mission of the Neighborhood Medical Center?
Definitely. Neighborhood Medical Center, our mission is to strive to provide and facilitate access to health care and enhance the health of individuals through education, prevention, and outreach. And we make sure that we serve our patients with respect and compassion.
Wow. Well, that's a mouthful.
It is.
What a mission. That's very ambitious, as a lot of our nonprofit missions are. But you've been doing it since 1974. So that's no joke. Y'all have been around for a while. So how long have you been with Neighborhood Medical Center?
So I started with Neighborhood Medical Center. I had to sit back and think about this one for a while because I couldn't believe it had been that long, but I started in 2010.
Oh.
So that's how long I've actually been with Neighborhood. I became the interim CEO in 2015, and then I got the job as the permanent CEO in April of 2016.
Oh, wow. So you've been at this for a while.
I have. It's a great place to be.
Apparently, obviously it is. And your leadership, I'm sure, is definitely well received. I mean, boy, this is great to have you in that position. And I'm really curious too, because a global pandemic is like, it almost seems with your mission, like it's right up your alley. Right up your alley. But I've got to ask you this. So how was it preparing and pivoting to this atmosphere of having a global pandemic?
It was a lot. It happened fast. I remember us having the last in-person staff meeting we had in February of last year, and there were, I think, 8 cases in our area. Like I can just remember that on the PowerPoint presentation that our Chief Medical Officer, Dr. Foster, did. And I was like, 8 cases, okay, if we could stay at 8, because this is going to be a lot. And look at where we are today. But we went we dived right in. We knew that we had to be a part of the response and that we had so many people in this community who depended on us. As a federally qualified health center, we are here to provide access to care. So there was no option for us to shut down. There was no option for us to stop doing what we're doing during the pandemic. You know, our mission is to make sure that people have access to primary care. And now with COVID, we had to make sure that people still had that access. We definitely had to change the way we provided care. Prior to the pandemic, we were doing some telehealth services. Usually, most of our telehealth was provided through our mental health program. Well, as soon as COVID hit, that expanded to just about every service that we provide. So we have primary care providers doing case management, all of our behavioral health team, not case management, telehealth services. Our entire behavioral health team went to telehealth services. We started teledentistry. So we just ran the gamut with everything. Everything became a virtual platform so that we can make sure that our patients still had access to us, especially when they need us the most.
Right. And you already had your mobile unit in place too.
Yes.
So that was amazing that was already ready and good to go and ready to use. And
yes.
you quickly pivot to doing COVID testing, from what I understand, from the mobile unit.
Yes,
right?
definitely. We were doing testing every day at our location on the Orange Avenue location. We had testing venues set up at our Brevard location, which is inside the Lincoln Center. We were doing the testing outside, of course. We were also partnering with Leon County Board of County Commissioners and their Leon Cares program and doing testing at different pop-up sites in the community. We're still actually doing testing. You know, we want to make sure that people still know that it's important to know your status. It's important to stay tested. So we actually have a testing event coming up this Sunday at the Northeast Branch Library out in Killearn. So we'll be there this Sunday from 2 to 5 doing COVID-19 testing as well.
Okay, and let's just clarify the day, because this will actually air to the community on April the 14th. So when you're saying this Saturday,
this will be in past tense. This will be April 11th. Yes.
So what do you have coming up, though? I'm sure your calendar's always busy, but what do you have coming up like after that April 14th?
So we'll continue to do vaccinations. We're doing pop-up clinics. We're taking our mobile unit out. We have some partnership opportunities with Second Harvest of the Big Bend. We've been doing food distributions once a month with them, and we partner with them with their neighborhood empowerment series. So every other Friday, we've been going into neighborhoods with our mobile unit and some of our primary care providers and meeting people where they are in their neighborhood. So we have a lot of outreach opportunities coming up. We didn't want the pandemic to stop what we do. We do a healthy happy hour. It used to be in person, now it's virtual. So our healthy happy hours have now turned into a podcast series. Wow. So we're extremely excited about that. So if anybody is interested in doing a podcast, Mateus and Joe have been amazing at making that happen and let me know. We have different topics that we would love to cover. You can visit our website and view the podcast that we've already done, because we wanted to make sure that people knew that we were still here. Instead of coming in, if you weren't comfortable, you can visit our podcast, be a guest on our podcast, ask questions. We wanted to be here for our community like we've been since 1974. Wow,
Jeanne, that's incredible. I love the quick pivot, but I also love hearing how amazing the collaboration has been for the organization as well, too. But it sounds like you have already had those relationships where you've been collaborating with different organizations and agencies in the community already.
Yeah, the spirit of collaboration is alive and well in Tallahassee. We have partnered with just about everybody you can think of. That's what made our response to the pandemic just monumental. We were able to partner with people like TMH, Capital Health Plan, the other FQHCs in our area. And we all came together and we did what we had to do to take care of our community.
Phenomenal work. Well, then let's go back a little bit more into that leadership piece.
Okay.
Because all of these things take amazing leadership. And I know most people want to be humble about it. You're focused on like getting the work done and the mission and everything, but the leadership skills that are required to orchestrate this are just incredible. And so what are some of the areas in your role as the CEO that you have found during this 1.5 years roughly? What have you found to be successes that you kind of stepped back and you were like, yes?
I guess I have to often attribute what people seem to think is my success or neighborhood success to the team that we have here. Teamwork is at the essence of everything that we do, and having amazing coworkers makes all of the difference. I could not have done any of this without the team that we have here at Neighborhood. These are frontline workers. Everybody pitches in. They do what they can. I must say that communication has definitely been key. I thought I was a good communicator before COVID, but you turn into a different type of communicator in a global pandemic. It's nonstop communication, and I always tell my team, there, I'm not going to ask you all to do anything that I wouldn't do. So if it's answering the phone, if that's what it is, I'll do it. The mission is taking care of our patients. At the end of our day is, what have you done to help our patients? And if you haven't done anything to help a patient, it wasn't a good day.
Right.
So
Right.
just, the communication is key with the people that you're leading, and trust and honesty. There's some things, hey, I may throw out. You guys tell me how this sounds. If it doesn't sound good, tell me, because I need to know that, I have you all support just like you have mine.
Right. Right. Well, that's the foundation of all the leadership, really, communication. So I
Mhm.
think, thank you so much for bringing that out, and even recognizing that within yourself. It's like, whoa, your communication has elevated to a whole nother level that you've
Yes.
never experienced. And I think a
Yes.
lot of people are doing some self-reflection during this
Oh,
time.
definitely.
you
Definitely.
know. So if you don't mind sharing, I mean, how has the pandemic impacted your staff and your team? You've got frontline workers, you've got leaders. I mean, how has it made an impact on your team directly?
It's definitely taken an emotional toll on our team. I wish I could just kind of take everybody away for just a few moments of just woosah and just, relax and not think about COVID for just a few minutes, because it's a part of our everyday lives now. We've had staff members who have dealt with COVID. We've had staff members who have lost family members. And I mean, not just a cousin down the line, which is just as important, but people who have lost parents. This has definitely impacted our staff and changed the perspective on how we view things in life in general. And it's been hard to watch that. It's definitely been hard to see people suffer in that way. And when people were in the hospital with COVID during the beginning of the pandemic, you couldn't have any visitors. So it was
Mm-hmm.
hard to see staff members who had relatives who were in COVID, and those who have transitioned, and to know that, their mother, their father died alone. That was very hard, and it wasn't me directly, but it was hard to see that. It was hard. I guess you empathize with people, so, and you have compassion, but that was a hard one. That was a very hard one to watch.
Right, right. And then, I mean, considering your staff, you're in the health, physical health, mental health, you're in that field. So
Mhm.
you know what it takes to take care of, others. And you got to kind of accept that for yourself too, with being
Right.
able to step back and take care of the health. So how do you keep your staff motivated?
We always talk about what our goals are. So goals are a way to keep everybody motivated. This is what we want to get accomplished. This is the impact of what we want to accomplish. And it's not about us. It's not about us. It's serving is about giving of yourself and making sure that you can help others, taking care of the most vulnerable. So that also comes back to us making sure that we stay okay. So we check in on each other, make sure everybody's good. Hey, I think you might need a little break for a few minutes. You take a time out, we got you covered. It's that kind of camaraderie that we share here at Neighborhood.
Oh, that's fantastic. Well, on that same, we're talking about, everyone taking care of everyone else.
Mhm.
Um, but, how do you keep yourself motivated?
Well, I have these bundles of joy at home, and everything I do is about them. I want to make sure that I'm making an impact so that they have a mother that they can say I'm proud of, and that's my mom. So making sure and making this world a better place for them. So that definitely keeps me motivated, and to be able to go home and see their faces, and nobody's sick, everybody's healthy. That's a true blessing. So that's all
Right.
the motivation I need.
Oh, there you go. Yes. Well, I've got 50 million questions, but I know I promised I'd keep it short and to the point. But my last one though for you would be, and you've mentioned a couple of things here and there today, but what have you learned about yourself, during this global pandemic? I heard communication as one, and what's something else that maybe you've learned about yourself during these times?
Hmm. I've learned I did not need as much sleep as I thought I did. That's one. I definitely learned that I was able to pull from a place that I don't think I had been to before to help take care of my coworkers, and be here to lead. I mentioned to you earlier, I just had a baby. And one of my chief information officer yesterday, we were talking about just a random conversation, and he said, "Yeah, while you were on your fake maternity leave," because yes, because I didn't have them. I was out of the office, but I think I worked every day. They teased me. I was working the day I had Brooklyn. It was a lot because the pandemic didn't stop, and it was so important for me to make sure that my team had everything that they needed, the support from me and the commitment, because we're in this together. So, I'm thankful to my family for allowing me to occupy the position that I have, because it is definitely, it takes a toll on your family sometimes too, because you're always being pulled in different directions. So I think I've learned how to try to balance things. That's what's become most apparent to me, figuring out what's my work-life balance in the middle of a pandemic. Because
Right.
work-life balance, everybody talked about it before, but it's definitely different in the middle of a pandemic. It definitely,
Right.
especially when you're in healthcare.
Yes.
Yeah. So work-life balance is what I've learned the most about myself and how important it is.
And how do you think you're doing in that aspect?
I would give myself maybe a low B.
Ah,
A low
okay.
B. I'm learning.
Okay.
I'm
Okay.
learning. Yeah, I'm learning. I'm a social worker by trade. So, as a social worker, you just get in and you do, 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 do. That's how we taught. And if you're a social worker like me at heart, even before I got the degree in social work, that was the type of person I've always been. I don't wait on anybody else to do something. So
Mm-hmm.
I'm just a doer. And sometimes you kind of have to let people help, let
Mm-hmm.
people
Oh,
help. So that has
yes.
definitely been a highlight for me during this pandemic.
Right, right. Wow. Well, those are great words of wisdom. Thank you, Jeanne, for sharing all of that information and being so transparent.
Well, thank you.
Big air hugs to you and your
Yeah,
team for the amazing work that you're doing in the community. It's
thank you.
absolutely incredible. And yes, I'm sure not realizing you don't need as much sleep. Wow. Yeah.
I'm sure it'll catch up with me sooner or later.
Well, let's say way later,
I
like way
hope
later,
so.
right?
I hope so.
Well, Jeanne, thank you so much again for sharing your time and your expertise. And of course, if there's anything we can do for you, family, and again, I say extended family, being your team at Neighborhood Medical Center, then please let us know. Again, congratulations on Brooklyn. I love the name, by the way.
Thank you. Thank
But
you
we
so
really
much.
appreciate your time. Take care.
You too.
Bye-bye.
Bye-bye.